Hello and welcome to my presentation about computed tomography or CT scans. Computed tomography scans, also known as computed axial tomography or CAT scans, are a type of medical imaging that is used to look at a patient's internal structure. CT scans utilize X-rays to achieve this. X-rays are classified as a form of high-energy electromagnetic radiation. When compared to other types of electromagnetic radiation, X-rays have a higher amount of energy than visible light, but less than gamma radiation. This energy makes them useful in the medical field as they are able to pass through many objects. They aren't able to pass through more solid materials such as bone or metal, making them ideal to image internal injuries such as broken bones, as they would show quite clearly on a scan. When comparing X-rays and CT scans, there is one fundamental difference. X-rays are only able to image the body from one set fixed point. This is only useful to a degree, which is where CT scans are great for. CT scans are able to create three-dimensional images of the body, increasing the detail and clarity for doctors and technicians in aiding in better diagnosis. When performing a CT scan, the patient lies on a motorized table attached to the scanner. The table then moves slowly into the scanner, which typically looks like a tube or a donut. Inside this donut, there are two components, an X-ray source and an X-ray detector. To scan the patient, the X-ray source and detector move in tandem around them. The source emits X-ray radiation, which is then weakened, or in other words, it loses energy, as it passes through different types of bodily tissues and organs, such as the lungs or heart. It loses energy because the X-rays collide with the electrons of the organs. This loss of energy is then picked up by the X-ray detector on the other side, which converts it into an electrical signal. This signal depends on the amount of energy that is absorbed by the electrons that the X-rays collide with, as they can either lose some of their energy, such as in soft tissue, which appear grey, or can lose a majority, like in bones or metals, which stand out in white. The electrical signal made by the detector can then be interpreted by a computer to produce an image. These cross-sectional slices of the patient are called tomographic images, which is where the name computed tomography is derived from. When these slices are digitally stacked on top of one another, it can create a 3D image many times clearer than a typical X-ray, thanks to the higher number of angles it is captured from. Although X-rays are commonly used to diagnose major bone fractures and dislocations, CT scans can go much further in helping medical professionals in their diagnosis. CT scans, because they are so much more detailed, can visualize the blood flow in certain organs such as the brain and heart, and see where blood clots or internal bleeding may be occurring, as well as see more subtle features of bone fractures. They are also able to see where cancerous growths and tumors are forming, such as in the lungs. There are both many advantages and disadvantages to using CT scans as a diagnostic tool. CT scanners can provide high-quality imaging to aid in diagnosis. They can be used in emergency situations after accidents due to how fast they are able to capture images. They can also be used to capture virtually any part of the body, and newer technologies allow scanners to create a three-dimensional image of a patient's body. At the same time, some disadvantages of CT scans include exposure to radiation, which may provide a cancer risk if CT scans are done frequently, and the inability to differentiate between different types of soft tissue, such as organ and muscle, limiting their usefulness. This is where other technologies, such as magnetic resonance imaging or MRIs, may come in handy. All in all, computed tomography scans are an amazing technology, which have bettered and saved the lives of many people around the world. With further development, the detail and utility of this scan will be improved. Thank you for watching my presentation.